Hi and welcome back to our page. If you want to start a care service in Wales, maybe you've worked in care for years, you've seen how it should be done, you've also seen how it shouldn't, and somewhere along the way you decided that you could do this better, that you could build something that actually puts people first. Or maybe you've already started running a successful service in England and you're registered with the CQC. You've been through inspections and you know the system, and now you're looking at Wales. New territory, new opportunities, and a chance to grow. Whatever brought you here, you're not short on ambition. You know what good care looks like, you know the difference you want to make. But then you start looking into CIW registration and you realise this is going to be more complicated than you thought. Wales has its own regulatory framework, completely separate from England. The regulator is Care Inspectorate Wales. The legislation is the Regulation and Inspection of Social Care Wales Act 2016. The requirements, the terminology, the expectations different. And it's not just surface level differences. In England, you write the statement of purpose. In Wales, you need separate statement of purpose for each regional partnership area where you want to provide services. There are 7 of them: Gwent, North Wales, Cardiff and Vale, West Glamorgan, Cumtaf, West Wales and Powys. Each one sits on its own version of your statement of purpose, tailored to that specific area. In England, care workers don't need to register with a professional body. In Wales, every single care worker must register with Social Care Wales within 6 months of starting work. It's a legal requirement. And your manager? They need to register too, and they need to hold or be working towards a level 5 qualification in leadership for health and social care. These aren't small details, these are fundamental differences that affect how you set up, how you recruit, and how you operate from day one. After some time of helping providers register with CIW, we've seen what catches people out. And let me share the most common ones. The responsible individual role. In Wales, the responsible individual is the person legally accountable for your registration. If you're a limited company, this must be a director registered with Companies House, not an employee, not a consultant, a director. And CIW will interview a responsible individual before granting registration. They'll ask about governance, oversight, quality monitoring and safeguarding. They'll want to know how this person will fulfill their duties under Part 16 to 20 of the regulations. Your RI can't answer confidently, your application stalls. The Welsh language active offer. This one confuses people. You don't need Welsh-speaking staff, that's not what it's about, but you need to demonstrate in your statement of purpose how you'll meet Welsh language needs. CIW will ask your responsible individual at interview how they intend to promote Welsh language and culture in service. It's about awareness and genuine commitment, not fluency. But if you haven't thought about it, it shows. There's also Social Care Wales registration for your whole team. Your manager must register your Social Care Wales as a social care manager. Your care workers must register within 6 months of starting, and there are qualification requirements attached. Workers can register initially with a level 2 core qualification, but then they need to complete level 2 or level 3 health and social care practice within 3 years. We'll also need systems to track all of this. Registration dates, qualification deadlines, continuing professional development from day one. Next, the rating system. From April 2025, CIW awards ratings to domiciliary support services: excellent, good, needs improvement, or poor. These ratings must be displayed on your website, they're public, and your first inspection isn't just about passing, it's about how you'll be seen by every commissioner, every family, every potential client who looks you up. This means the stakes are higher than they've ever been before. We've also spoken to providers who tried to do this alone. They downloaded the CIW Statement of Purpose template, they adapted their policies from their CQC registered service, they filled in the CIW online application and submitted it. And then they waited. And CIW came back with questions, clarifications, requests for more information, and the timeline stretched. Weeks became months. Some got through eventually, others had to withdraw and start again. The ones who struggled weren't bad at care, they just didn't know what they didn't know. They didn't realise their statement of purpose needed to address the active offer they didn't understand that CIW was really asking for in the Responsible Individual Suitability Questionnaire. Registration delays cost money. They cost momentum and they cost opportunities, and sometimes they cost confidence. That feeling is maybe I'm not ready for this, when actually you're ready, you just need the right support. You may be wondering why I'm saying all of this. Well, we're CareSync experts and we help care providers register and grow. In England with the CQC, and in Wales with CIW, and Northern Ireland with the RQIA. We understand how these systems work because we work with them every day. We've supported providers across all 7 regional partnership areas in Wales, new startups with a single director and a dream, established providers expanding from England, family businesses, social enterprises, each one different, each one with their own vision for what their service could be. What we bring is clarity. We know what the CIW is looking for, and we know how to present your experience, your governance, your service model in a way that meets their expectations. We know the questions your responsible individual will face at interview, and we know how to prepare them to answer with confidence. Our CIW registration package covers everything you need to submit a strong application and launch with confidence. We start with your statement of purpose. We write it properly, aligned to the CIW template, structured the way CIW expects, covering your regional partnership areas where you want to operate. This includes your service scope, your staffing structure, your governance arrangements, your approach to the Welsh language active offer, your complaints process, your fees and terms, all of it, written professionally, not copied from a template. We build your policy suite, every single policy required under the Regulated Services Regulations of 2017. Safeguarding is aligned with Wales Safeguarding Procedures, Medicines Management Meeting Regulation 58, Complaints Meeting Regulation 64, Whistleblowing, Safe Recruitment, Infection Control, Data Protection, Governance, Staff Supervision and Development, all written for Wales, all ready for your operations from day one. You also prepare your responsible individual and your manager for their interviews, one-to-one coaching sessions, mock questions based on the 4 areas of the RI suitability questionnaire, how you'll appoint and oversee your manager, how you monitor the service, how you fulfill your duty to visit at least every 3 months, and how you conduct quality of care reviews. We don't give scripts, we build genuine understanding so that when CIW asks a follow-up question, your RI can answer it. We support your application through CIW Online, evidence uploads, submission checks, and when CIW comes back with questions, we help you respond. We stay with you from the first conversation to the registration decision. With us, registration isn't the end, it's the beginning. Once you're registered, you have ongoing duties, notifications to CIW when certain events occur, annual returns, quality of care reviews every 6 months, keeping your statement of purpose up to date and preparing for inspections. We give you a compliance starter pack so you understand what's required and you're not caught off guard. Templates for quality reviews, guidance on notifications, A ratings readiness checklist, so you know how to present your service when that first inspection comes. You won't be left wondering what to do next. If you're serious about launching a domiciliary support service in Wales, we'd like to help. Book a consultation with us, we'll talk you through your plans, confirm your regional partnership areas, and show you exactly what the journey looks like. CareSync experts, let's get you registered.